We have to put our big boy pants on, and we have to do what it takes to keep our community healthy and safe while we're dealing with this crisis.
Now at 5, as the number of hepatitis C cases continues to grow, the Allen County Health Department is moving forward with a plan to create a needle exchange program. Good evening. With around a 20% increase in cases of hepatitis C reported locally, the health department wants to act quickly. News Channel 15's Sara Wagner learned more about the plan's progress today, and she joins us live in our newsroom with tonight's top story. Sara?
Yesterday, every board member voted yes to a resolution approving the needle exchange program. With the number of cases growing here and across the state, health department leaders tell us it needs to be developed as soon as possible.
This is a serious crisis.
The health department has seen 270 cases of hepatitis C just since January. While those aren't necessarily new cases, it's the first time they've been reported. It's also higher than any of the past 3 years.
250 is about where we are usually for the whole year.
The program's concept is simple. Drug users bring in used needles and get clean ones. Each kit would cost roughly $5 and include everything from cotton balls to a disposable container. The health department hopes to put the center where it'll get the most use.
We've been looking at areas based on emergency runs for overdoses.
Opponents of the program argue it promotes drug use and can further addiction, but health officials think otherwise.
Every major medical organization and federal health agency supports this.
Dr. McMahon says needle exchange programs have been around for the last 20 years.
On average, probably about a 30% reduction in HIV cases in areas where they're actually implemented and used.
Since the federal government bans public funding, the health department has to find the financial support from other means.
What we're initially going to look for are donors.
Moving forward, the health department will meet with the community as well as public officials. It also needs approval from the state health commissioner.
I'd like to do it with the community. I don't want to have, sort of an adversarial relationship with anybody. I think the evidence is there.
If everything gets approved, the health department hopes to open the center sometime next January. We're live in the newsroom. Sara Wagner, News Channel 15.